So one question that we've been getting is about adverse effects, and I think that's a total fair question related to any treatment. We think about doing more formal consents when we do a surgery or a procedure, but every time we offer a treatment, we may talk about pros and cons, but we don't necessarily put them in the formal language of risks and benefits and possibility of adverse effects. So for one, to put it simple, as our patient testimonial showed earlier, the symptoms of COVID-19 have a far greater potential of causing adverse effects, of keeping somebody out of work, of causing morbidity and death than the COVID-19 vaccines do. So it is fairly common to have a mildly sore arm, assuming that the arm was the injection point, and possibly some mild fatigue for 24 hours. That should be expected, and that's the systemic response of your immune system revving up. That's not a bad thing. That's not you getting infected or anything like that. That's your immune system starting to rev up. About 5% of people, so 1 out of 20, will experience more significant symptoms of fever, headaches, and severe fatigue. So severe fatigue that might keep somebody from going to work for a day, but that's 5%. 95% of people have mild to no symptoms. Contrary to what might be intuitive, it's actually, as we get more senior in age, we are less common to experience significant adverse effects. And it's partly due to how robust our immune system responds to vaccines. But while a mild amount and a usual amount, if somebody gets a sore arm from an influenza vaccine, they should expect a mildly sore arm for the coronavirus vaccine. The three other panelists, have you seen anything different from that?
No, certainly the younger people seem to have more of a reaction, which fits with the more robust immune system. I think that has caused some people to bypass getting the vaccine because they're worried about the side effects. But I think, as Destiny, our patient here, demonstrated earlier, young, otherwise healthy people can get very, very sick with COVID-19. A lot don't, but you don't know. And a sore arm and aches and chills, headache are annoying, but the chance of becoming vaccinated and keeping it from spreading and not taking your chances with the side effects of the wild virus, I think, are far outweigh the risk of not getting vaccinated.
And I honestly, I might be the least touchy-feely emotional person on this panel, but one of the reasons why I was on the first day that vaccines were offered in Carroll County was that this decreased the chance of me giving it to my family, you know, to my teenage boys who are not eligible for the vaccine yet, that I'm more than willing to go through mild side effects to protect my family. And from a more selfish point, to make sure I'm remaining at work, that I'm not having to get sick and miss out of days and weeks of work. The pros far outweighed the potential risk of a worsening sore arm, and that for me.